What's going on, you guys? My name is Julian. I am a second-year medical student at St. George's University, and today I'm going to be talking about exactly what to expect as you enter your first term as an SGU medical student. Stay tuned. Alright, you guys, welcome back to my channel. If you are new to my channel, I would love for you guys to hit that subscribe button, hit that button down below. If you guys are returning back to my channel, thank you guys so much for all of you guys' support. I am super excited to share with you guys what I wish I would have learned as a first-term medical student going into SGU. So let's get right into it. When I first went to SGU and what I wish I would have known as a first-term medical student was that we don't have different types of classes for different subjects. It's just one class. So what I mean by that is you don't go to one class for 1 hour, to another class for another hour, and then to another class for another hour, so on and so forth. SGU is a system-based medical school. What that means is they're going to take a whole bunch of different topics from the entire body and put them into a certain one single class. And what this one single class is basically a class for 2 hours. You have 2 lectures a day. You're gonna have one class, so you're gonna have about 10 minutes in between each class, but this is just one certain class. And you're gonna be having 2 different lectures for 50 minutes each. So every single day, you're going to have 2 hours worth of lecture material. Now keep in mind, again, you're not gonna be going to another class or to another another part of the campus. You're just gonna be going to this one lecture hall. You're gonna be presented 2 lectures for that day. You're gonna go home, post-read, do all your post-read stuff, and that is basically what I mean by a system-based learning medical school. So the first class in your first term of your medical school journey at St. George's University, the class is going to be called Basic Principles of Medicine 1. And within that Basic Principles of Medicine 1, you're gonna have 5 exams, and each one of those exams are gonna cover a different module. For example, Module 1 is going to be Fundamentals to Medicine 1. Module 2 is going to be Fundamentals to Medicine 2. Module 3 is going to be Musculoskeletal System. Module 4 is going to be Cardio. Module 5 is going to be Pulmonary and Renal. So with that out of the way, I'm gonna go ahead and tell you and break each one of these modules down and tell you guys what to expect as you go into your first term as a SGU medical student. For the first module, you're gonna be looking at the Fundamentals to Medicine 1. You're gonna be going over topics including cell structure and function, certain drugs and mechanism of action, karyotyping and use of microarrays, apoptosis and necrosis, as well as many types of disease associated with genetics, such as Turner syndrome and Kliefender syndrome. One thing I always tell students before they go into SGU is to please have some basic understanding about histology. What histology is basically looking at things under a microscope when it comes to the human body. Different types of epithelium, squamous versus cuboidal. You're gonna have to learn all that stuff and be really familiar and comfortable with that when it comes to your small groups. If you come in with some basic understanding of histology, you're going to have a much smoother time than I did. A typical exam question for this module, Fundamentals to Medicine 1, is: a 20-year-old male comes to the physician because of a 6-month history of severe acne. He was previously treated with topical antimicrobial agents, which were ineffective. An oral treatment of tetracycline is prescribed. Which one of the following is the most likely mechanism of action of this class of antimicrobial agents? For your second module, Fundamentals to Medicine 2, you're going to be learning topics such as gene regulation, clinical pharmacokinetics, population genetics, the autonomic nervous system, and cholinergic agonists. A typical exam question for your second exam, Fundamentals to Medicine 2, would be: a 40-year-old male is being administered a continuous IV infusion of an antibiotic at a dosing rate of 100 milligrams per hour. His plasma steady state level of antibiotic is 200 milligrams per liter. The antibiotic follows first-order kinetics of elimination with a half-life of 2 hours and a VD, volume of distribution, of 15 liters. The infusion rate is doubled. Which of the following will be the new steady-state antibiotic concentration? If you double the dosing rate and the clearance stays the same, the steady state is also doubled. Therefore, the new steady state concentration is 400 milligrams. Now you're going to be going into your third module, which is Musculoskeletal System, or MSK for short. Now, one thing's very clear for the musculoskeletal system, MSK. You don't need to be an anatomist in order to do well on this block, in order to do well on this module. I had zero background in anatomy, and now that I look back at it, I still wish I would have learned more of the anatomy as far as like where parts are located, because there are some questions on the exams where you're just gonna have to know where something is in relation to another. But for the most part, I want you guys to know that MSK, the MSK module, is more about clinical scenarios. For the MSK module, you're going to be going over topics that include anastomosis of blood supplies, the vertebral column and spinal cord, clinical anatomy of the shoulder and arm, clinical anatomy of the lower limb, and something we know as fush injuries, or falling on an outstretched hand injuries. A typical exam question for this module would be, a 65-year-old female is brought to the emergency department after a car crash. Physical examination shows a complete paralysis of the upper and lower limbs. An X-ray of the cervical spine shows a posteriorly displaced fracture of the dens, which resulted in severe compression of the spinal cord. Which of the following ligaments is most likely torn? Again, many students struggle with MSK. I know I did, but I still was able to at least pass that exam and move forward to CPR. You are able to do well on MSK without having any anatomy background, but I still highly encourage students to take some type of anatomy before coming to SGU. For your fourth module, CPR 1, you're going to be learning more about the heart than anything else. Topics include various diseases of the heart, such as tetragiophalo, membranous ventricular septal defects, right or left ventricular hypertrophy, anatomy of the heart, learning how to read a basic ECG, and atrial and ventricular depolarization. A typical exam question for this module would be, a 75-year-old woman passes out while exercising. Her past medical history shows no heart complications. She has intermittent external chest pains and dyspnea. Her physical examination reveals a crescendo-decrescendo systolic murmur at the right upper sternal border. Her S2 sounds is very soft, and her carotid upstroke is weak and delayed. What is the most likely diagnosis? Now, the last module for your term 1 as an SGU student is going to be CPR 2, which is going to be comprised of the pulmonary and the renal systems. These topics include anatomy of the lungs and kidneys, including the urinary system, diseases associated with the lungs such as COPD and pulmonary fibrosis, diseases associated with the kidneys like nephrotic syndrome, multiple myeloma, central and renal diabetes insipidus, and alpha-1 antitrypsin deficiency. Learning how to interpret lab values of important salts such as potassium and sodium, and learning about clearance and different substances used to determine clearance such as albumin and creatinine. A typical exam question for this module would be, an 86-year-old woman comes to the emergency department because of 2-week history of difficulty breathing. Arterial blood gas results are obtained at basic room temperature and pressure. The pressure being 760 millimeters of mercury. The atrial pulmonary oxygen is 55 millimeters of mercury. The atrial saturation is 78%. The partial pressure of carbon dioxide is 52 milliliters of mercury. The pH is 7.17. Administration of supplemental oxygen via nasal canicula increases the atrial oxygen to about 125 millimeters of mercury. Which of the following pressures best approximates alveolar pressure of oxygen in the patient before oxygen supplementation? Awesome. So now I just kind of broke down and gave you a little bit of basic information for all 5 modules and what to expect. But there's 2 other exams that you're gonna have to worry about: the lab exam and the OSPE. Let's talk about the OSPE first. Now, the OSPE stands for Objective Structured Practical Examination, which is basically where you go into a room, you're gonna have a standardized patient, and you're gonna have to perform certain maneuvers on that patient according to the prompt given to you before you enter the room. Each one of these rooms are gonna have a proctor inside. And I'm not gonna lie, your grade is basically really dependent on the proctor. And I know that from personal experience. What I mean by that is, during my first term, I felt like I did horribly on the OSPE. But because I had really good proctors, I got a really good grade. This last term, I felt like I only messed up on 2 certain things. And honestly, I don't know about the proctors, but I actually got a less grade than I did on my term 1. So, I don't know, say what you like about the OSPEs, say what you like about standardized patients. I'm not a big fan of them, but they are there, and they're worth about 50 points of your total grade. The second exam that you have to worry about besides just your 5 lecture exams is going to be your lab anatomy exam. Now, I'm not a big fan about the lab anatomy either, just because of the fact that these donors have been handled pretty severely by many staff. And for me personally, I felt like it was really hard to identify certain structures because of the fact that they've been handled such a long time and by so many people. But it's doable. As long as you keep up with lab hours and you're able to do some Anki, look at some pictures of those ligaments and know the difference between a ligament and an artery, you should be fine. All right, you guys, today we talked about the 5 modules that you should be learning as a Term 1 medical student at St. George's University. We learned a little bit about the OSPE and how it's set up, and we learned a little bit about the lab exam and how it's set up. Thank you guys so much for tuning in to my channel. I really appreciate all of your guys' support, and I hope to see you guys next time.